Things that makes you happy suddenly makes you sad. Nothing seems to be working. Everyone has given up on you. You feel worthless, empty, and blank. You want to die, but are afraid of death. Maybe you are experiencing what is called depression. We live in a world filled with ups and downs, filled with terrible and negative experiences, situations, events. At some point in time, we all feel sad. We all have these down feelings. However, in depression, these negative feelings tends to be long-term, intense, and most times they affect our ability to function. Join me as I introduce you and help you to understand what depression is all about. Thank you for joining us today. By way of definition, depression can be defined as a mood disorder which is characterized by persistent feelings of sadness, guilt, and loss of interest in activities that were once pleasurable to a particular individual. Now, let's look at the hard facts of depression. These are facts that have been tested and proven over time. So many research is done on these, and these are the results that have been discovered about depression. Firstly, in the year 2018, it was discovered that depression was the major cause of suicide and disabilities. It is also estimated that every year, about 800,000 people commit suicide every year in different parts of the world. These are estimates. Now, secondly, just anybody can go into depression. The rich go into depression, the young, the old, the poor, even celebrities encounter depression at some times in their life. So depression cuts across every race, every ethnicity, every economical background, and every status. Thirdly, sadness and grief are not the same as depression. Now, there's a difference between sadness and depression. There's also a difference between grief, experiencing grief, maybe as a result of death of a loved one, and going into depression. Depression is usually longer. Sadness and grief just occur for a very short period of time. And when the person is relieved, that's all. Next is that women are more likely to experience depression as compared to men. Now, these are as a result of numerous studies that have been conducted worldwide. It has been found that the female folks tend to experience depression more than males. That does not mean that males do not experience depression. It just means that women are more depressed as compared to the male counterparts. The next fact is that depression affects major parts of our lives, ranging from our physical health to our psychological status to our financial life to our social life. It affects our social life, affects different, even the spiritual life also. You could just lose your interest in God or whosoever you worship. Lastly, on this note, depression can be treated. There are several effective treatments for depression, which I'll be sharing with you in the course of the topic of today. Next, we'll be looking at the causes of depression. The causes of depression ranges from biological to genetics to medications and also to lifestyle events. In the aspect of the biological part, this involves biochemical variations, alterations in the brain, where either hormones or neurotransmitters that are supposed to be normal in the brain in a specific amount in the brain, they now become abnormal. Either they are too low or they are too high. When these alterations occur, they affect our mood, they affect the way we do things, and it could lead to depression. However, when medications are taken to stabilize the amount of these substances, it is discovered that the person is lifted out of depression. The next cause of depression is genetics. In genetics, we mean that a parent who is depressed is likely to have a child that will undergo depression also. So depression most times can be transmitted, can be transferred from parent to child through the genes. That's why it is genetic. Then thirdly, there are some certain medications that can cause depression. Not that they cause depression per se, but their side effects tend to make an individual have depression. Then fourthly, we have life events. These events are negative events that occur to we individuals once in a time in life. For example, unemployment or loss of job, divorce, broken relationships, broken marriages, violence, abuse, neglect, poverty, lack of financial strength, death of a loved one. It could be a relation, it could be a friend. Also, we still have traumatic events like accidents. Accidents could lead someone to have depression. The person just becomes tired of life. So these are a few causes of depression. Let me know other causes in the comment section. Now we'll be looking at the symptoms of depression. Depression has different symptoms ranging from physical, social, psychological, and others. First of all, one major symptom of depression is the feelings of sadness, guilt, excessive guilt, hopelessness, feeling of worthlessness. I am nothing. I don't deserve to be praised. I don't deserve anything good. Just feel empty. There's no hope for me. I'm tired of life. Someone with depression can experience suicidal attempts or suicidal thoughts, tendencies, feel like ending up life, feels like killing his or herself. Another symptom of depression could be the physical symptoms like sleeplessness, loss of appetite or appetite changes, easily tired or low energy, poor concentration, lack of interest in things that were once enjoyable. Also have withdrawal from friends. Now we'll be looking at the types of depression. First of all, we have major depression. In major depression, this is a depression that lasts for a long period of time, most times 4 weeks. It could run into months. Then this leads us to the next type of depression, which is the persistent depression. The persistent depression lasts for a longer period of time, from 2 years upwards. So you discover that this person is still experiencing depression even after 2 years. Then the next is bipolar disorder. In bipolar disorder, the person switches between high mood and low mood. The person experiences a mental condition called mania and depression at the same time. The person is like switching, alternating moods. So you discover that today this person is very, very happy. And this person has in fact, it could be destructive. Why? Because of the amount of energy. And suddenly, the person just experiences a low mood, starts feeling sad, starts feeling guilty, and the likes. So that's about bipolar disorder. The next on the list is depressive psychosis. In depressive psychosis, a person has depression. However, the person also experiences some psychotic symptoms. For example, hallucinations and delusions. Hallucinations meaning that the person is seeing what is not there. He's hearing voices. Meanwhile, there's nobody speaking to him. The person is, feeling touches that are not there, that are not existent, but the person feels it. That's hallucinations. Then in delusion, these are false beliefs. The person just feels that, I'm the president of the United States of America, I'm the president of this, I'm the world inventor, I did this. Meanwhile, the person has not gone that far. That's that about depressive psychosis. The next we'll be looking at is situational depression. In this type of depression occurs as a result of specific events. So it could happen as a result of death of a loved one, unemployment or loss of job. It could happen as a result of an accident. It could happen as a result of poverty, lack of financial strength. There is an event that made this depression to occur. That's situational depression. The next one we have is premenstrual dysphoric disorder. In this case, the individual, a female, enters into depression just some days or some weeks before seeing her period, before menstruation. Just starts feeling sadness, starts having this blue feeling. The next one we have is perinatal depression. Perinatal depression involves depression that occurs during pregnancy or within 4 weeks of childbirth. The pregnant woman experiences depression while pregnant, and if care is not taken, could still experience that depression after childbirth for within 4 weeks. So that's about perinatal depression. The next thing we'll be looking at is the treatment options available for depression. Wow, depression can be treated. That's the news I'm bringing to you. Yes, it can be treated. First of all, it depends on the cause. For example, if checks are done and discover that it is as a result of biochemical alterations in the brain, medications are given called antidepressants. We have different types of antidepressants. We have the selective serotonin reuptake inhibitors and many other types of antidepressants. So when you meet a psychiatrist is going to prescribe the exact antidepressant that is suitable to the type of depression you are having. So there are medications that treat depression. The next on the list is psychotherapy, or what we call talk therapy. So in this case, a person experiencing depression meets a psychologist, and the person needs to ask this depressive person questions. At the end of the day, a conclusion is reached. Another treatment for depression is lifestyle modifications. In this case, the person that is depressed begins to regulate some of his or her lifestyle activities. For example, the person begins to eat healthy diets. The person avoids alcohol, because alcohol sometimes or most times is a depressant on its own. The person also may engage in regular exercise to lift his or herself out of such depressive mood. The person also engages in social interaction, meet friends, meet families, always with someone, discussing with someone, just to avoid that mood. And before you know, these depressive symptoms, these thoughts of killing oneself begins to diffuse away. Finally, we have an electrical therapy which is called ECT, electroconvulsive therapy. This therapy is used in the hospital majorly for people with chronic depression, meant to undergo an electrical stimulation of the brain, after which the person loses consciousness just for a while. And by the time the person wakes up from that loss of consciousness, you discover that the mood, the biochemical activity in the brain is stable. These are the treatment options available. I believe I've been able to help you understand what depression is all about. Well, I would like you to share your experiences about depressions if you have any. You can share about it, tell us about it in the comment section. You don't know, you could be helping someone. Well, thank you for listening to me today. If you've not subscribed, what are you waiting for? Hit the subscribe button and hit the notification bell for more educational videos. Thank you and stay safe.